Mandela and your leader and founder, Fidel Castro, we're still witnessing a friendship that continues. So you are most welcome to this country, and you will be surprised that our people at large appreciate you. They appreciate the work that you're coming to do in this country. They appreciate the relationship we have with this country, this beautiful country of Cuba. I just want to pause my welcoming notes on that so that we save time. But the second other thing I'm here to do is to introduce to you the executive management of the Limpopo Department of Health. Next to me is Dr. Ndwamato, who is the DDG for Tertiary and Academic Development Services. And over there, on my far left is Dr. Dombo, DDG for District Health Services, it's commonly said Health Services. And Dr. Ann Robertson, who is with Dr. Ndwamato in Tertiary and Academic Services. I've already introduced myself and a few of our colleagues around here. The district, the clinical manager of Manguing, Dr. Muira over there, and Dr. Hey, this must. I just thought I recognize the eyes. Dr. Murifi, who's also the clinical manager at Petersburg Hospital. These are our two tertiary hospitals. These are the two clinical managers that are here. You will get to know a lot of the other colleagues that are around here with us as time progresses. Welcome indeed, and we're going to proceed right along and request Dr. Ann Robertson to tell us who is here from Cuba. Dr. Robertson.
Thank you very much, Mr. Mawasha, and welcome to the team who we briefly met. Briefly, if you could just stand up when I say your name, when I get your name wrong. So to start with, we have a doctor and a professor of biostatistics from the University of Dr. Osvaldo Segura Sardinas. Would you like to? So Dr. Sardinas is going to be involved in our response. Okay. And then we've got a hygienist and epidemiologist, Mr. Adonis Baratute Jimenez, who's also going to be involved in our community response. And we have 8 family physicians, all of whom are going to be involved in the Cuban, community response to COVID. We've got Dr. Ilian Pina Mullet, Dr. Jose Luis Vasco Gelshausen, Dr. Jamilki Labensina Mendes, Dr. Indira Rosa Hernandez, Dr. Yosbel Moreno Comino, Dr. Marlon Niza Benitez, Dr. Luis Enrico Gruzon Iquila, and Dr. Leandro Gonzalez Moreno. And And then we are also very happy to have 3 biomedical engineers. The biomedical engineers are going to be assisting us in our intensive care response to COVID. They're going to be helping us with our ventilators and with our equipment and oxygen and all of those engineering things. And we've got Carlos Alberto Godin and Rubio. And we've got Carlos Alberto Campos Lopez and Anin Hodilan Leske. Thank you very much.
Thank you very much, Dr. Robertson. We changed the program slightly so that we enable the MEC to speak and then attend to other pressing matters. We are in the middle of a very pressuresome time with the fight against the COVID-19. And thanks that you came to assist us. It is a time that people are afraid. There's a lot of fear, but you came to hold our hand and assist us in this fight. Thank you very much. Dr. Dombo is going to introduce the MEC. Please give her a round of applause, Dr. D.
Good morning to everybody, and welcome to Limpopo Department of Health. I would like to introduce the MEC for Health, Dr. Poppy Ramathuba, who is a medical practitioner by profession. She's been in the profession for 20 years, involved in the political sphere in various leadership roles since her life as a student and beyond, and also been involved in the sphere of organized labor, representing health professionals, in particular medical practitioners. She is a dynamic person. She is a taskmaster. She demands excellency at all times. So when you are joining this team, that is the kind of team that you are joining. So what the MEC is looking for is not just excellency, but for Limpopo Department of Health to be exceptional. So I want you with those words to welcome the MEC.
Good morning. I'm trying to get my notes so that I don't get out of the script. Thank you very much, DDG. I'm told I must sit down. Oh, I'm not undermining. I was just told that I need to sit down when I do my presentation. It doesn't look good. It doesn't feel good, but we have no choice in this current difficult situations that we find ourselves in. We have to change how things will never be the same again. COVID-19 has just exposed us to show that we have not been living a normal life. So that's why during the COVID, when we are told to do even the basics of hand washing, we think it's a problem. Had we lived a normal life before, we wouldn't see this being much of a real challenge. Let me thank you, Program Director, our DDG for Corporate Services, Mr. Mawasha. Our HOD in absentia, who is busy representing us in other technical meetings that has to do with COVID-19. She would have been with us here, Dr. Mrongo. Our DDG Tertiary Services, Dr. Ndwamato, and our DDG for Health Services, Dr. Dombo, Dr. Robinson, our also one of those provincial heads of this program. I must also acknowledge the presence of Dr. Zaldiva if he's around, because we invited him. Oh, yeah, there he is. Also Dr. Zaldiva, who will be working very closely with you. And before you go outside, when you have guess what's happening today? We're able to record up to 16 cases within 24 hours. So that tells you that when you think that, and those who are sitting out there still thinking we're talking about a myth, just look at this clear example. From the 16th of March to today, which is the 18th of May, we are now recording 16 cases a day. When you record 16 cases a day in a province like ours, which is under-resourced, which is having serious challenges, you are going to have difficulties in managing it. We must also remember that during this time, that doesn't mean that those patients who still need to be attended to, who are diabetic, who are hypertensive, do not necessarily need their attention. They still need our response. They still need us to provide them with medication. But the challenge that we are seeing with which COVID it's giving us. One of the a physician called me panicking to say, some of the patients are not even coming to collect Dr. Dom. They are chronic diabetic medication because they are afraid if they come to the hospital, they might get infected by those that they don't know are infected. Those are the reality we're dealing with. Now, the problem is that if I'm diabetic and I'm not taking my medication, I now become at a much more risk, because should I get infected with COVID-19, I will not be able to survive. Patients who are on ARVs, we are emphasizing that we must also, it's time to look after them now to make sure that they continue to take their medication. Because if they don't take their ARVs, it's going to be a double disaster on them. But if they take their ARVs, we know that they will be suppressing their viral load. And once they suppress the viral load, they will be able to fight the system. Their immune system will be able to fight COVID-19. But if they don't, they won't be able to fight. So those are the realities that you are going to be dealing with in this particular province. I know that the acting HOD will still take you through the reality on the ground of how Limpopo it's all about. But I just felt maybe it is important for you to can remember that you are coming to one of the most rural provinces. It is rural, I will not lie to you, because the South African healthcare system, which he has got prior 94, we had a system that was discriminating or segregating us based on the color of your skin, the language that you speak, the ethnic group that you come from. If you were a vendor-speaking person, you would visit only a hospital that is meant for vendors. If you are Tsonga speaking, you'll do the same. If you are Pedi speaking, it was the same. If you are white, you were better off. You were privileged. You had a better, well-resourced hospital. It was like that pre-94. We were able to defeat that post-1994 and deal with that past and make sure that it doesn't matter. When you are sick, you will be attended to the nearest hospital that is closer to your home, irrespective of your language, the color of skin, or wherever geographical location. If you are sick, you must be given attention. But then what happened between 94 and today? We developed two healthcare systems. We are moving away from discriminating based on the language and the color of your skin. Now what we are doing, we have two healthcare systems which discriminate based on the size of your pocket. If you have money, you will go to the better one. The previous one that I'm talking about, it was legislated. It was an apartheid law. So in terms of the law, it was not wrong. What was wrong was the apartheid law. But the system was there, gazetted in parliament and allowed. But what we currently see today, it's not in any law. It's not gazetted anywhere. It's what people just came in. That the capitalist system was able to develop its own private healthcare. Now, the private healthcare in this province can only cater for 8% of the people of this province. 92% of the people of this province are dependent on the public healthcare. That's the reality on the ground. So you can calculate, we have got a total of around 6 million people in the province, and you can look into 92% of those are dependent on us as a state. The remaining 8% is dependent on the private healthcare. And what does that mean? It means the public healthcare will be overburdened, being underfunded, because if, as a politician myself, as an MEC, I have got the medical insurance, who is funding that medical insurance? It's the very same public. Now the poor subsidize the rich in this country when it comes to healthcare system. Because there is no way, if the taxes that we are paying are be able to subsidize, because my medical insurance, it's subsidized by the state. I only pay a small portion. But a poor woman who also contributes towards VAT is not getting that benefit. So these are the health reforms that you will hear that as a country we are trying to deal with, and to try to correct that, to say you can't have two-tier systems. You must have a healthcare system that will be dependent on your illness. If you are sick, we must triage you based on your severity of your illness. If you are sick and you are triaged, if let's say an accident scene, when we go there, we must triage and say this is a priority one. We give them the red card and transport them to the nearest facility, irrespective of whether it's public or private. If you have got minor scratches, you must go to you must be the last one to be looked after. But the reality on the ground, what is currently happening is that if I am, let's say, traveling in my car with my helper, my domestic worker, and my children, and we get involved in an accident, the chopper that will come, which is privately owned, will airlift me even if I have scratches to the best healthcare private facility in the country. The nanny, even if she's a priority one with head injuries, she will wait for the emergency medical vehicle from the state, which has got many other people to deal with. So we are trying to address that when we speak about the health reforms. And we want to believe that if we are to do that and everyone be insured, everybody must be insured in the country, then everyone will have access to healthcare. The outbreak of COVID-19, it's just telling us that there is in no way, as South Africans, you can continue to discriminate. You can continue to think that the haves must have the better health access, the have not must be not having that. So it's just showing us, and I like to believe that after this whole outbreak, as South Africans, we are going to think soberly and realize that investing in the health of a nation, it's what is really needed. We are inspired by your country, I must indicate, the manner in which your healthcare system has been run, because it's a basic human right to you. And the mere fact that your life, in terms of when you look at your health system and looking at ours, you can realize that your life expectancy, it's now over almost 80, if it's not 79, somewhere there. The last time I checked, you were around 80. You look at your under 5 mortality, you look at your maternal mortality. The other year, you were the first country to record the eradication of mother to child HIV transmission. The whole world, you were the first country to do that. We get inspired when we read that. We get inspired when we read that you are no longer amputating the diabetic foot, but you do try, you have medication to can try and do that. We read about when we take our students to go and study in Cuba, and when they come back and they struggle to treat malaria, I always tell my fellow clinicians that they can't, because they've never seen malaria, because Cuba has eradicated malaria. They've dealt with the mosquito at a lower stage. Those are the things that inspire us and say, as a country, you might be having few resources compared to us, but you have been able to do a lot for your own people. And these are the things that, as the province, as a country, we can learn from you and see ourselves also having to improve our life expectancy. We are still struggling, but we have improved. At some stage, we were even somewhere at 52, but today, at least, we are improving. We have been at, I think, around 64. We continue to improve on a day-to-day basis, but we think your coming in will help us. One of the issues that I need to warn you is that this is what even Dr. Zaldivar will agree. Your predecessors who came here make that biggest mistake, is to come in and get swallowed by the system. Instead of coming here and provide your expertise, you start doing the South African way. We are running a curative healthcare system, which is not sustainable, whereas you are running a preventative healthcare system. The reason we want you here is for you to help us to deal with the preventative medicine. How you were able to eradicate measles, how your children are no longer getting, it's shocking to hear that there's someone with measles, if the person has studied in your country, because you are no longer dealing with that. Infectious disease, you are no longer dealing with. We are inspired by who say of doctors, doesn't assist. Just the socio-economic issues that are making people to get sick. That's why you saw him actually transforming to become a revolutionary and a soldier and fight for the liberation, because he knew that continuously sitting in the consulting room, you are just going to see your people sick because there's TB. The reason is because your people are staying there in the squatter camp. They are staying in that wherein for them to spread TB, it's easy. Fight for them to get proper housing, you'll eliminate TB. Fight for people to get proper sanitation, proper water. You'll deal with typhoid, you'll deal with malaria. So you will deal with typhoid, with cholera, and all those other even waterborne disease. So this, why am I raising this? It's because President Fidel Castro, I'm sure you will know that my building has also been named after him. When I came here, I felt we need to rename after him, because we read a lot about him. We read, we get inspired. We want to, as a province, develop policies that are inspired by his teaching. And when he said we weren't offering money, we were offering doctors to help save lives, and that offer still stands today, tomorrow, and represents Cuba's attitude towards the People's Republic. That message will remain relevant as long as, even like today, when we are to deal with COVID-19, you are not only coming to help South Africa, but you are going all over. Even those people who never thought one day they will have Cubans in their country, today they are having you to assist to deal with that. So hence, when I say I'm raising all these things, is because including what President Cyril Ramaphosa, when he welcomes you, he said, open quote, the deployment of Cuban doctors, engineers, and technical experts in all the provinces of South Africa, rendering important services. It's a demonstration of a strategic partnership and solidarity between South Africa and Cuba, and a good example of South Africa-Cuba cooperation. So you remain our friends, and you will remain those that inspire us for us to can do better, so that we become like you. So that one day I look back and I said, we've been able to push the life expectancy of people of South Africa from that 64, from that 62 to now at 80, because we are still struggling to get to 70 in terms of our national development plan. We want to reach 70 first, so that we can find ourselves one day getting to 80. And if we adopt your style, we will be able to win. Now, we are saying, in this mission that you are coming, we are going to be letting you assist us even in the strategic thinking on what is the approach. You will spend the week with the team understanding the health system in our province. Don't be afraid to raise your views. This is Limpopo, where clinicians are given an opportunity to lead. The politicians must follow clinicians when it comes to fighting disease. But the clinicians must not become politicians. Clinicians must speak like clinicians. Clinicians must be evidence-based. Clinicians must be able to look and assess and say, in order to deal with this problem, this is what is really needed. They must not speak in different languages and change stories. You see, I'm a politician. I used to be a clinician. I converted to be a politician. So I'm allowed to can change my stories every day. As a politician, I develop new ideas daily. I can't remain static. But as clinicians, as you develop new ideas, they must be based on research. They must be based on evidence-based medicine. It should not just be thumb-sucking. It should not be based on populist slogans. You are not politicians. You are clinicians. That is why in this province, you will be given an upper hand in terms of your thinking. If you have brilliant ideas, my number is available, freely available. My PA will give you, all of you, so that you can have access to me, to talk to me directly, to say, MEC, This is what is happening. Look, if we don't win this, it's my head that must be chopped. If we win this, it should be me who must be glorified. So that is why I want smart people around me. I don't want to be surrounded by yes person. Yes, I agree fully, exactly, Kokeli. When you know I'm messing up, don't do that to me. When you see I'm messing up, correct. The president did not just go and call you for fun. He calls you because he knows that we can learn from you. We want to, since the outbreak, and since we record the first case, as a province, ours has always been trying to even copy what you were doing. That's why we become unpopular in certain quarters, because we are seen as if we are taking decisions that are not democratic. We are saying the key to this virus, as long as we don't have the vaccine, as long as we don't have the treatment, must be on screening and quarantine, testing and isolation. Now, even currently, the battle that we're having with the mines is on quarantine and isolation. I'm saying to them, you can test, you can screen, but if you can't isolate or quarantine, there's no need. There's no need to do that. So those are the key. If I am exposed to the virus, you are a typical example. You came to the country. When you arrive here, you stayed for 14 days. Why were you being quarantined when you are all negative? We must be consistent. We quarantine you, you were negative. So this is what I'm saying. Anybody who has been exposed to this virus, irrespective of where, if I live where I am now and go somewhere else, I must be quarantined before I'm mixed with the others. So this is for me, where the key in terms of winning this battle. So we have always been saying, let's quarantine everyone who has been exposed, positive or not. And if I'm a close contact, the moment you start to say you are testing me, quarantine me while I'm waiting for my results. When they come out negative, quarantine me, because those results are dependent on the timing. They might be negative while I'm positive. It's the timing. That's this. Let me just clear my name so that you can know when they say it's the problematic MEC, what they mean. It's that which I'm also asking the minds. Currently, we're having serious problems in the mind. And that's where we will want your brains. We will want your assistant to say, how do we get zoom in into those minds and make sure we clear and mop it out. We must contain it. We don't have the luxury of all those ventilators that we see people in Europe displaying. We don't have those luxury. We don't have the luxury of top physicians. We don't have that luxury. We can only win it on the street. And winning it on the street means quarantine. And if you test me, I'm positive. You can't tell me to go back to my settlement and isolate myself when I'm staying in an informal settlement. Doesn't make sense. So you can see this is where my battles are. If I test positive, provide me a room for isolation. In that way, you know I'm isolated, and during the isolation, you are monitoring my symptoms. If I start to show illness, then we will admit you in the hospital setting. Those are the simple things that I'm asking for. And people do not want to provide, but people want to continue to profit, to make profit. I'm also worried about the economy of my country. I'm also worried about economic activities, the well-being. I've told you that after this COVID, we'll have serious problems. But at the same time, my also conscious, my moral obligations, my ethical obligation still remains with the lives of our people. And I think in Limpopo, you are welcome here, where you are going to be allowed to think, and you will be allowed to express your views. Dr. Dombo will not stop you. If she does, you come directly to the MEC. Then the other thing that I need to just share with you, this is what I've shared to all the workforce. You are our soldiers, our frontliners. We want you safe. Before you get into attending to any patient, first protect yourselves. The painful thing would be on the day of your departure, that there might be empty chairs. That will be the most painful thing. We might be healthcare professionals, we are the most vulnerable. People think by being a doctor, you are immune for being infected. You are actually the most vulnerable. So protect yourself. These two must make sure you have all your PPEs. Without PPEs, don't attend to any patient. You are allowed not to. Why should you attend to a patient when you don't have protective clothing? That's one area which I'm telling them. If they want me for me to smile with them, they must first make sure that you have your PPEs. When you have your PPEs, you can then attend to patient. So make sure you protect your life first before you attend to a patient. And let's not be casual. Let's continue to treat everyone as if they are COVID positive. If we do that, if it's our attitude that everybody is COVID positive, we are going to win this battle. And of course, we can't send you to any battle to die. We must give you the guns to go and fight. And for us, for you, the guns is simple. It's just those PPEs to go and do that. And I'm saying to South African doctors, I can see the two clinical directors. I didn't welcome them, Dr. Muila from Mangwe and Dr. Murifi from Petersburg Hospital. These are the two biggest hospitals. They will be with you and interact with you later. I'm saying also to all South African doctors who are out there, I was on one radio interview today. I want to reassure you that we will never have enough number of doctors to deal with this virus. No one is here to take your job. They are here to augment what we are trying to do. The virus is too big for us to can think we will win it on our own. So we are simply saying we need each and every one. They are here to support us, and we must, all of us as a province, we are known to be the province of love. We are known to be the province of caring and a province of humility. So I'm reassuring you that when this is over, you will hear the province, people of Limpopo will be thanking you and appreciating you. Some of you will not even want to go. I can reassure you, after this whole battle, you will see how loving the people of Limpopo are. So this is not the time for competition. This is the time for complimenting each other. It is a time for us to say, let's get together. Let's work and fight this spread of pandemic. We must work together. Today, our cases, as I'm concluding, in the province are at 93. We've got 4 new cases in the last 24 hours. As you can see, and as expected, these are the cases coming from the mining area, from the Skukune area. We also, Madikwe mine has also recorded another case, which they did not have. They've got the first case now that they've recorded. And Dwas River has also recorded new cases. So you can see that all these new cases that are coming now, they are coming from the mines. So if we look at the hotspot as a province, our hotspots remain the mines. So that is an area where we will be able to look into that. And of course, schools will be opening very soon. You are also requested to be looking into how do you then advise, especially the Department of Education, because they want answers from us as health. So ours is to advise them. You should be able to come and let's put our teams together. Some of you will be stationed at head office with Dr. Dombo, for instance, our biostatisticians. They will be here with us, where we will be looking at all that. But there are some of you who will be there at the community for you to be able to deal with that, working together with our medical officers in those areas, also our community healthcare workers, our professional nurses who are on the ground. We have also been able to discuss with the university, the principal, the Nelson Mandela Fidel Castro students who are currently doing their 18 months block here. They will be joining you so that we go out with them. They must form part of the history that they fought this. And I think they are at an advantage because they know your health system and they've also been exposed to the South African healthcare system. So especially family physicians, you will be working with those ones the support you're going to get across, and we are going to help each other. Let's show them what we can do. That solidarity that international solidarity can never be defeated by a virus. The international solidarity will definitely defeat the virus. So I'm saying, let's go all out. The president of the country has already released you, and I'm also repeating his words. I have been requested by the Premier, by the way, because of his commitment today, same issues, he could not, and then he has said, I must say this to you, go out there, go and fight, help save the lives of the people of Limpopo. At the end of the day, yours is to preserve and save lives. You know nothing in your life except those. For you, life is more important than anything. That's why you are even prepared to sacrifice your own life, donate your own life at the expense of others. And noting that in this province, you are going to be protecting the most marginalized and the poorest of the poor. It's unlike probably in other provinces. In this province, you'll be dealing with those, the most vulnerable and the most poor. Thank you very much.
All right, thank you very much. You can be seated. Protect yourself. Go out there and save lives. If you screen and test, be prepared to isolate and quarantine. Other questions from the fourth estate? We are allocating about 10 minutes of this. This hand was first. Mr. Moore or Neil, come here. This is your job.
Okay. Start with the ELCA, SABC capability.
Thank you very much. Skara Mafukwan from ENCA. MEC, in your own words, the mining sector is a big problem in terms of outbreaks. Can you perhaps take us into your confidence as to how the Cuban Brigade's intervention in the mining sector is going to be? Thank you.
Thank you very much, guys. From SABC News. MEC again directed to you. The trajectory of the virus again in the mining Sekhukhune area does not appear to be subdued at the moment. Cases are increasing, although not as exponential. How is the intervention by the Cuban government going to be likely add towards flattening the curve? And again, if the MEC can run us into the areas specifically, maybe mentioning part of the problem.
All right, thank you very much, Titus Tungu from Cuba. So with the deployment of these doctors, given the cases are climbing every day, when are we going to see them deployed and reporting for duty? And how are we going to avoid the communication barrier between the doctors and the people on the ground? Thank you.
Okay,
Thank you very much. Let me start with Titus, your last question, which is the language barrier with the committee members. I've already indicated, right now there's no language barrier. They can all speak English, which is almost, it's perfect for us. Now, when you come to, they're not going to be working alone. If maybe you want to refer to our rural, the most deep rural areas where our mama cannot understand English, they are not going to be working alone. We have indicated that besides the 47 final year medical students that will be deployed in their family medicine block to those who are going to the area, we're talking about 8 a brigadier who will be going to directly into the community. Those who will be working with our own teams. We have said to you, we are not throwing them in the deep end. We've got a tracer team of 585 professional nurses. They are going to be working with them. We are talking, that is the community outbreak response teams that we are talking about. We are also talking about the community healthcare workers. Remember, when we started our testing and screening, we had more than almost 10,000 around there, cadres that we deployed. They will be working with them. So there will never be any challenge in terms of the language barrier or understanding the demographics and the dynamics. They're not going to work alone. We have that all planned and sorted. Then when are they going to be deployed? We are going to spend this week with the orientation. I've indicated to you that we need to present to them. They must understand the healthcare system in the province. They must also understand the dynamics. We must also sit down, especially with the epidemiologists and the statisticians. They must be able to look into the map and see the behavior of the virus together with our team. And then from there, I'm sure Monday, Dr. Monday, they will be out in the field and be working. But we must provide that orientation this particular week that they are going to do. And then what you are asking in terms of the mining, the mining, they're going to assist us because now we are saying to the mines, the good thing, we have identified where the problem is. If you remember, if I give you the background, and I think it's you, Titus, who were interviewing me to say, we are moving towards level 4 and some sort of economic activity. The Minister of Mineral has announced on the 50%. And we said when we go there, we are expecting that people from other provinces who have been on the lockdown at their homes, they will be coming to the province. The numbers at the province were very low at that time. We were somewhere around 20-something. They will be going, and I indicate they are going to skyrocket. The reason being, we're going to start to see inter-provincial transmission. And this is how we feel should be the response. And we have said we need to do, during the lockdown, we did our mass screening and testing. The mass screening and testing was focusing on the household, which we screened more than 4 million people. 4.4 million people were screened. And we tested 4,125 were tested. And the outcome of those tests, it's not even more than 10 that were positive from that. And then we indicated that this is giving us a picture that in terms of our province, the virus has not been at that where people, we had thought it would be. Now we are going to move to another phase of screening. That will be the targeted screening. And now the target screening, it's now, this is what we are going to talk about. This is where I'm saying they are needed. The targeted screening, we have looked at where the cluster outbreaks are, the mines being the area. So that's where they are going to be much more relevant. Because for now, if you look at a district like Vembe, we don't have a problem. The last time we recorded the case, we don't remember. We've just even put them at green. But they've got Venetia mine. And I must, even today I'm having a meeting with them to discuss about this issue of saying, how are you going to quarantine and isolating? Because when you screen and test, you must be able to have those systems in place. So we are going to be utilizing them in our phase 2 as we move of targeted screening and testing. And I think in terms of that, they are very good. That's why their numbers remain low. That's why they were able to eradicate the diseases, maybe to respond to Katlev. That's why they've been able to eradicate infectious diseases in their country, because they are very good in preventing the disease start within the community. They are not starting within the hospital. The problem is that as South Africans, we think the disease starts in the hospital. You don't think it starts in your community. You don't think you get sick within the community. You take them to your household. From your household, you'll bring them to the hospital. So they understand and they've mastered that. And that's what, as a rural, poor province, we've always been advocating for. To say prevention is better than cure. After all, we are a Department of Health, not a Department of Disease. That's why when you asked me about cigarette the other day, I said to you, unfortunately, I'm not the MEC for diseases. I will not advocate for cigarette, which I know it will cause diseases. I'm the MEC for health. I will advocate for anything that prevents diseases. So when you ask me that question, it becomes a difficult one. I can never advocate for alcohol when I know it's going to cause you illness, liver cirrhosis. I will be wrong. You will drink it, but I will tell you it's wrong to drink it. So I will not advocate for that. So we are saying this target screening, to respond to you, Kat, will be focusing on those targeted areas, especially your mining. You remember I was also raising with them that education, the schools will start to be reopening. This is another area where we are going to be utilizing them to begin to understand. Now, the other area which we think they are going to assist is that, as I always mention, that it is not a problem for many of us who are here to get infected. We can fight the virus out and defeat it. We are much more frustrated and worried, and we spend sleepless nights by the most vulnerable, those with comorbidities, those who have got other conditions. So now, this targeted screening that we are going to be doing, it will also be coupled with getting all the vulnerables outside the community where we think, for instance, when we are going to Beggarsford now, we will be going to Beggarsford as a province now to be putting all our resources in that particular area. The Fitakomu Tubatsi municipality, it's where we are saying it is our epicenter. We today have 32 active cases in that area. So if you have got 32 cases, only one recovery, and those cases happen within a week. It's not like it's cases that, by the way, this district I'm talking about spent through our level 5 at 0. When we were level 5 lockdown, the district was at 0. Now the district is an epicenter. The municipality is now an epicenter. It's got 34 cases, 1 demised, 1 recover. Then we are left with 32 who are active cases. So we need to zoom in there. When we zoom in, we must start now to do the mopping. We must start looking at the community members who are vulnerable, who has been screened. We're going to be screening and testing. We must provide resources, both government and the mines. That's what is going to happen now, to say the little resource that we have must be there. So hence we said to you, the phase 2 will be on targeted screening and testing. We have passed the mass testing and screening, which we did on our own, and it yielded our results. But now this is the next phase that we are going to.
All right. Do we still have another set of questions? Maybe one. Let's see what there is of hands. And if not, thank you very much. We will allow the MEC to remain for one-on-one. So, over to the stage.
Thank you very much. One more applause for the honorable. Let's now get into the orientation program, the nuts and bolts now. Can we request Dr. All right. Okay, let's pause for a moment for a group photo. Then we will come back for the nuts and bolts.
Group photo, you want in fact
We'll still touch social distancing.
Kat, how are you?
I'm welcome to the even if they are doing social distancing, social distancing.